Here on your screen, you see the MLN education tool for Medicare Preventive Services. This is available online without any portal access or username, password to see it and use it. I encourage everyone who sees Medicare patients and bills for preventive services to take the link in the video description and bookmark it if you don't have it already. I'm going to walk you through this wonderful tool that is provided so that you can make sure that you're capturing all the revenue available to you for the services you provide to Medicare patients when it comes to preventive services. Every tile here is a preventive service, and you can click on it and it will give you information. Before we do that, you can see that you can print this page in the upper right-hand corner. You have an overview section here that if you click, it gives you the information. It says it's an educational tool so that you can properly provide and bill Medicare preventive services. And this is specifically for patients with Medicare insurance. So you're billing Medicare Part B. It covers the national coverage determinations, the NCDs. It has telehealth eligibility indicators. It shows you HCPCS and CPT codes, the diagnosis ICD codes. It tells you what's a prolonged preventive service. You could click on here for the definition, and it's indicated by a little clock icon. It shows coverage requirements, how frequent you can bill and see patients and treat them for these services, what the patient cost share would be out of pocket if there is one. It's very, very, very helpful. This is a good little tip down here on eligibility that when requesting a Medicare patient's eligibility status, we give the dates they may get certain preventive services or data to help determine the next eligible date. If you're unable to get this data, contact your eligibility services provider, which would be your MAC. And then there's little links for FAQs and for checking Medicare eligibility. So if we go here, we get the MLN fact sheet, which could be very useful as well. Okay. So I'm going to go ahead and get out of this. It's 5 pages. And we're going to go back to the last screen. All right, so we're back to this screen where all these tiles are, and you can see that you can select a service. There's an FAQs option up here and another resources tab. Down at the bottom right, you can see the MLN number and the date this was last updated, which was April of 2025. In the bottom left corner, you can see that a T with a circle around it indicates it's an eligible telehealth service, which means you could bill for seeing a patient with this service via telehealth. Okay. And if you click on that, you'll see this little thing pops up and it has other links that you can use and it takes you to telehealth specific information. I get a lot of questions about telehealth and Medicare. Here you go. These are some great resources. All right. So back to the tiles. These are so, so wonderful. And I can't stress enough that this should be definitely studied. Make yourself cheat sheets if you provide these services often, because this is just leading you down a path of treating patients thoroughly and getting paid for it. I'm going to go ahead and I'm going to select over here the initial preventive physical exam. We're not going to go through all of these, but this is definitely one that I want to go over. First of all, you can see that it takes us to a new screen where it's just about the IPPE, which is the initial preventive physical exam, or what a lot of us like to refer to as the Welcome to Medicare preventive visit. You will even have patients who are new to Medicare say they want to schedule their Welcome to Medicare physical, because a lot of them are aware that this is a service that they can get. On the right-hand side, you could even print it if you wanted to keep a binder maybe on your desk or located somewhere for people to reference easily if they don't want to bookmark it and get it electronically. You can see also it says what's changed, and it says there were no changes for the calendar year of 2025 quarter 2. All right, so over here, it tells you which HICS, PICS, and CPT codes you can bill for this visit. It is the G codes, and it also provides the definition, so you can definitely make sure you're following the guidelines. Here's the little clock indicator that states it's a prolonged visit. And then down here, you get to see which ECG you can perform and get paid for depending on the patient's situation. Then you also have, if you're an FQHC, you can bill out the G0468. Okay, so make sure you're taking a look at this, looking at it very thoroughly. Now you have the ICD-10 codes, so it says additional ICD-10 codes may apply, find individual change requests, and everything is from your MAC's website, which you can find from this link. Medicare covers, so patients with Medicare Part B gets this covered once within the first 12 months that they become active with Part B coverage. Make sure you're not getting this mistaken with Medicare Advantage plans. Those are going to be a little bit different. The frequency of this billed code is a 1 per lifetime. So once a patient comes on to Medicare, they have 12 months to get their initial Welcome to Medicare exam, and they cannot have this billed any other time, the G0402. That does not mean they cannot have other preventive exams. You just can't bill this specific code and offer these specific covered services for more than once in a lifetime. Okay, and then you can see how to check eligibility again. Here's the breakdown of patient cost share. There's no copayment, coinsurance, or deductible. It's saying that there could be a copay, coinsurance, or deductible that could be applied to the other services, which are the ECGs up above. For G0468, which is up here, there is also no copay, coinsurance, or deductible applied. And then it has a note. You must provide an annual wellness visit or IPPE with a standard bundle of services available to all patients. And to get more information, you need to click on this link. This literally walks you through everything. If you can't find the answer here, then it's either an obscure question or you're not looking hard enough. I promise everything is here. You have the frequently asked questions as it relates to this service. It defines what a primary care setting is right here, and when CMS can add Medicare preventive services. Check this out. It's so, so wonderful. I know I keep saying that, but it's super exciting. You have no idea. So if I just scroll all the way to the top, like you saw me just go boop, you can see that it takes me back to the tiles, and we could select something else. You can do this for every single thing on here, and it will show you every single category that we just reviewed in this order so that you can be as informed as possible, and you can also help patients be informed in case they will have some kind of cost share and they're asking you about it. This is another reason why it would be good to be bookmarked on your browser, because if you're in the room with a patient and you have your computer, you could pull this up and show them. There are some patients that would be very interested in this, I'm sure. We're going to go ahead and we're going to come to the annual wellness visit, okay? So this is piggybacking off of the Welcome to Medicare. And you can see that there's different G codes here. Again, prolonged service icon. The G0438 is an annual wellness visit, and it includes a personalized prevention plan of services, and it's the initial visit. This is the code that you would bill the second year the patient is seen for a preventive exam. So they have the Welcome to Medicare, And then 12 months later, they would be eligible for another preventive exam, and you would bill the G0438 because now they're initially having their annual wellness. And then years 3, 4, 5, 6, and on, you would then bill the G0439, which is a subsequent annual wellness visit. And then you can see these other applicable codes that you can bill, and it tells you if they're time-based, which the 99497 is, and the 99498. Look this over and know how to bill. Again, these are telehealth eligible, as you can see in this upper left-hand corner. Here you go. Medicare covers are past 12 months, their Part B coverage period effective date. They haven't had an initial preventive physical exam or an AWV within the last 12 months. So basically the IPPE, or the Welcome to Medicare visit, is always in the first 12 months. And then after that, it's every 12 months you bill for an AWV. Just go ahead, scroll through this. Again, all of the same categories as we discussed prior. I'm going to go ahead and scroll back up to get to our tiles. It just slides on over. And you can click on any of these. If you're like, oh, this patient is a diabetic, what diabetic screenings can I run? Here you go, your codes, your diagnosis codes that need to be used because they follow the coverage details, the NCDs. And then down here, we cover a hemoglobin A1C blood test when a patient gets a diabetes screening. We cover 83036 every 6 months after using the modifier TS. Okay. And hopefully you have a coder in your office, but I know a lot of you small practices probably don't. If you're a new practice, especially, this is very helpful. Use it. It's going to be your best friend. If you click on FAQs, it just takes you all the way to the bottom of the page where that is. And then if we click on resources, it takes us to the very, very bottom if we scroll all the way down to this page. Now I'm showing you a different screen on cms.gov, and this is another link I will provide in the video's description. And this is actually breaking down preventive services for you if you want more information. You just click on these little arrows and it will break it down, and you can click on these to get more information as well. So they kind of go hand in hand together. You can see there's an educational tool link right here. And this should also be able to help you, and it will take you to the same place. However, there's different strokes for different folks, right? You might like the past screen better than this screen, and you prefer to use that. So that is okay. You can bookmark both. You can bookmark one or the other, whenever you like better. It's up to you, but I'm going to give you those choices in the video description with those links. Taking you back to this page, you can see that there's other resources at the top for Medicaid if you have questions, marketplace, private insurance, training and education. It's just a different link on the CMS website, but it's going to give you all the same information or connect you to the same places. I just wanted to show you that there's different places and different ways to find things. The last thing I want to show you before I end this video is that there is a very nice resource for patients to have. And I don't know if you want to make this available in your practice, maybe print it and hang it or have handouts that they can look at. But it's showing Medicare patients what is available to them when it comes to preventive services. This is all going to be tied to the resources that we've just gone over for providers. However, I think this is really nice if you have patients that have questions. I will put the link for this in the video description as well, but I thought it would be a nice little tool if you wanted something to provide to your patient. So I wanted to just finish on this little note, and you can see that there's some resources down below for patients as well if they were curious. I hope today's video was helpful. I hope that you learned something new. So if you have, I would appreciate if you would smash the thumbs up button, subscribe to my channel if you have not already, and please share this with your colleagues, maybe internally or even outside of your practice that you think would benefit from this information. I appreciate the support, and we will see you next time. Bye-bye.